I'm here with Victor Wang. He is with Friendi.fi, which is based in California, but attending the HITLAB Innovators Summit here in New York. So what brings you to the Big Apple? What did you want to get from this conference?
I'm here to present a poster with Friendi.fi actually about our Augur predictive AI for predicting conditions and costs of those conditions that are sensitive to like self-care, self-management. So we have a product that talks with people, builds a friendship with them. That's why we're called Friendi.fi. And then we leverage those friendships to affect behavior and outcomes. So I'm here to present about this way to target who would benefit the most from that kind of intervention.
So what's been the reaction?
It's good. You know, people come up, ask questions.
Right. Well,
yeah.
I think that's what you want, right?
Yeah.
Some interaction. Were you able to make the kind of connections here that you thought you might want to make?
Yeah, a lot of really interesting people. We're a really new company. We just started in September, so it's good to just kind of get the word out there that we exist and on all the interesting things that we're doing.
So when you say, all right, you've been around for 4 months, basically.
Yeah.
And so what is the? I mean, all right. So we have the timeline. Where exactly is your company right now? Where do you hope to take it in the near future?
Yeah, so physically we're headquartered in SF Bay Area. That's where our engineering team is. And essentially what we're doing right now is we're doing consumer pilots with two types of consumer groups. One is older adults with chronic health risks, and the other is autistic young adults. So actually, you know, Friendi.fi, we're making friends with people through text messaging. It's actually a conversational AI that we train and we serve and we own, and it's specifically designed not as an assistant or like a coach or you know, like a ChatGPT type thing where you ask it to do things where you tell you info, but it's designed as a friend. And as far as I know, in the healthcare field, we're unique because there's kind of these consumer-focused AI friends. You might have heard of like Character.ai or Nomi or things like that. They're out there kind of talking with people to build AI-driven friendships. But what we're doing is we're building a healthcare company around that idea and making sure that these conversations are safe and effective in driving health outcomes. And that's new. I mean, you interview a lot of innovators here, Jim, so you know, please tell me if if you come across a similar company doing something like that. But as far as I know, we're pioneering this. You know, this ability to build friendships at scale to enable, our mission actually is to enable everyone to have at least one healthy relationship. And once we have the consumer data to show the engagement and the loyalty and the ability to affect behavior, which is the stage that we're at right now, then we'll actually be selling into provider groups or provider payer groups where they're at risk for paying for, let's say somebody has anxiety and they have no friend to talk to, so they end up calling 911. They go to the hospital. The health plan has to pay for that, right? But what if they had a friend to talk with? They didn't have to go to the emergency department. Or what if somebody's about to be homeless, and you know they tell their friends that they're worried they haven't been able to afford rent for the last couple months. Doesn't occur to them that that's a healthcare problem, and that if they end up on the streets, they're probably going to have their healthcare costs skyrocket and cycle in and out of the hospital. And the health plan actually cares about that and wants to keep them housed. So eventually, we'll be selling into the provider groups and the health insurers. But right now, we're doing our consumer pilots to get that data.
Victor,
okay.
Pause for just a second.
I was going to say,
Your audio.
background.
Oh,
Sorry.
It just
it
gets.
doesn't actually sound that loud to me, but
You got to hear it.
yeah.
It's definitely getting picked up. Almost passed.
Well, you have an emergent topic there.
Yeah, I just want to make
I'm talking about the emergency department. Yeah.
Yeah, it was just lending
Okay, we're good to go.
natural
So sorry.
sound background. Well, let me pick up where you left off then.
Sure.
So where are you in the development of your product?
Yeah, so we're further along than you might think for a company that started in September, because it's actually a spin out from my first company that I started in 2012, and that's called Care.Coach. And back then, we didn't have Gen AI. So my mission then was to solve loneliness, especially for older adults. Just looking at my grandmother living by herself in Taiwan, I wanted to make sure people had the companionship that they need. And so we actually ended up hiring huge teams of people all over the world to staff a digital avatar that would talk to older adults here in the US 24/7. And it was artificial intelligence. And we've been doing that for 12 years. It's a successful company, got a great new CEO running it. And so we're actually spinning out of that company with a lot of unique data, and with some of the work that we've been building there with some National Institutes of Health funding, actually, to start building AI around that data to be able to automate some of these conversations. So we have a lot of the infrastructure in place. We just kind of need to prove it out in a new model, and we're delivering it not through a digital avatar like Care.Coach did, but through text messaging so that we can reach 98% of the US adult population just through an SMS. And in fact, it's thanks to HITLAB that we even figured that out, because a few years ago, HITLAB had a collaboration with AARP, huge membership organization for older adults in the US.
I think we've heard of it, yeah.
Yeah. And actually they had a thing called the Social Innovations Challenge, and we applied to that at Care.Coach and we won. And as a result, Care.Coach entered this AARP Age Tech Collaborative. And they were super helpful. They helped us do the consumer research to show that actually older adults, a lot of them text, and there's a common misconception that older Americans are not into technology. A lot of people are, and actually a lot of people are comfortable texting. And so we're launching this as a text-based conversational friend, including targeting older Americans and younger adults with autism. And so it's a different modality that we have to prove out the engagement data on.
Interesting that you've started two companies that are similar in nature but dependent on almost completely different technologies to advance.
Yes, one technology is human,
right?
And one technology is AI.
Right.
And actually they work really well together. So it's kind of like different places on the spectrum. So actually, even at Care.Coach, we use AI. It's more for like recommendations. It's to help the team staffing the avatar to come up with creative things to do. It's to help the team have a better memory about the people that they're talking with, so that they can, oh yeah, last week you told me about your brother. I was thinking so and so. Normally, it's actually really hard for people to remember these things, but the AI can help. Whereas at Friendi.fi, it's much more AI driven, and the humans are there just because the AI is not quite safe enough to trust to directly talk to vulnerable patients in a healthcare setting. So even at Friendi.fi for now, we have human review of everything to make sure that it's safe and it's effective. And if somebody has suicidal ideation, we make sure we pick up on that. And really, it's a healthcare company through and through, so we have to keep it safe. And so both companies actually involve humans and AI, but we're different sides on a spectrum.
I could see. I think we understand how they would certainly cross over. So, what do you need? Do you have any immediate needs? Do you need money? Do you need anything like that?
We're really just looking for pilot organizations that would be interested in trying this out with their population. So we're pre-funded. We have a lot of National Institutes of Health funding, and then some of our investors are rolling over funding. So we're not fundraising or anything. We're just looking for good pilot groups and to get data, engagement data. Again, so if anybody watching this has a population that you're in charge of and you wish you could build a much stronger relationship with each of them, and that helps with member experience, patient experience, loyalty, but then also once you have that friendship, you can leverage that friendship to do coaching much more effectively than some stuffy coach.
Yeah.
But it's your friend that's actually encouraging you to have a healthier life, to take your medications, do your physical therapy, exercise, book your annual wellness visit, all these things. Much more effective if your friend is doing that. And the other thing, if you have a population like this, is once you build individualized friendships with everybody, they tell their friends about all sorts of things, like what's called housing insecurity, but nobody thinks of that as a healthcare problem. What if their car broke down, they can't afford to fix it, they'll complain to their friend about it, but actually, you all serving a patient population probably care, because if their car broke down and they can't afford to fix it, it means they're not going to any medical appointments. So if anybody out there wishes they had these capabilities and this kind of closer connection with your population, especially older adult population and autistic young adults, that's what we're looking for, is to help people get the data and get out there.
Looks like you're very well positioned in a very interesting space, and
it's going to be big, yeah.
Yeah. Well, we look forward to. Well, I tell you what, we'll have you back 6 months from now, and we'll sit down. And we'll talk about the progress you've made and the success that you've undergone. How about that?
What's happening in 6 months?
Another one of these HITLAB conferences.
In 6 months. Yeah. Okay.
Yeah, exactly. All right, Victor. Good luck moving forward, and thanks
James.
for coming by and having a chat.